Hi, my name is Julian and this is a compare and contrast video on the Gracey and Universal Curette. I will be focusing on the Gracey 1, 2, 11, 12, and 13, 14, as well as the Columbia 13, 14 Universal Curette. Proper instrumentation is essential for effective scaling. I'll be showing you the parts of the instruments, proper grasp, the correct working order, angles for usage, and indications and contraindications for use. Towards the end, I'll be showing you in detail the usage for each instrument in my typodont. I will first start with the instrument parts. These are the handle, the shank, the working end, which include the toe and the blade. Looking at the toe of these instruments, both the Gracey and the Universal Curette have a rounded toe. These are designed for subgingival scaling to avoid laceration to the tissues. All the instruments I have here have a cutting blade, but their configurations are different. The Universal has two working cutting blades at each end, while the Gracey has one working cutting blade and a non-working edge at each end. Next part on the instrument is the shank. The terminal shank serves a crucial role in determining the correct working end for instrumentation. This angle in the terminal shank can help us identify the lower blade, which is the working edge used to remove deposits. Please note that the Gracey 1, 2, you will have to look at the instrument straight to identify the lower blade. The grasp used with all these instruments is the modified pen grasp, which provides control and precision when instrumenting in the mouth, in conjunction with the proper fulcrum for stability and control of the instrument. This is a demonstration of the modified pen grasps, holding the instrument with your thumb and index finger in its relaxed C shape, using your middle finger on the shank for stability, and using your ring finger to use as a fulcrum in the mouth. Now moving to the working order and angles, we have an insertion angle which should be as close to 0 degrees to the tooth and a working angle between 60 to 80 degrees for effective calculus removal. Remember that an angle of insertion close to 0 degrees minimizes tissue trauma, and once inserted, the blade is open to an angle specific for the instrument. Moving to the instrument, the Graceys have one cutting edge per end, making it self-angulated with 70 degrees angle in relation to the terminal shank. This instrument I have right here is the Gracey 1112. It's used for the mesial surface of posterior teeth. The shank is offset, helping us identify the working blade. The toe is rounded for subgingival scaling. The working order is you start at the distal line angle and move mesially, keeping the terminal shank parallel to the long axis of the tooth. This other instrument is the Gracey 1314 and is used for the distal surface of posterior teeth. The shank is also offset, helping us identify the working blade, and the toe is rounded for some gingival scaling. The working order for this instrument is you start at the distal line angle and you move distally, keeping the terminal shank parallel to the long axis of the tooth. Now this is the last Gracey. This is the Gracey 1, 2, used for anterior teeth. The working order is after you identify the lower blade and have inserted into the pocket, you work from the midline to the interproximal areas using the Pac-Man to remember the direction to work towards and maintaining the handle parallel to the long axis of the tooth. Now, for our Universal Curette, the blade has a 90 degree in relationship to the terminal shank, and when instrumenting, the terminal shank should be tilted 10 to 20 degrees towards the tooth to obtain a proper 70 degree angulation for effective calculus removal. This instrument I have right here is the Columbia 1314 and it's a universal instrument. It has two cutting edges per end, allowing it to use on all the tooth surfaces. The toe is rounded for some gingival scaling as well. When using this instrument on posterior teeth, you had to adapt to both mesial and distal surfaces, working for the distal line angle to the distal and using the same end, but just rotating the instrument to scale from the distal line angle to the mesial surface. This is a demonstration on how you will use all these four instruments. In summary, the Gracey curettes have one cutting edge per end, while the universal curettes have two. Gracey curettes are self-angulated, and universal curettes require manual angulation. Gracey curettes are area specific compared to the universal curettes that can be used on all surfaces.